guys, Sez the Vet here. So I'm going to do my very first Q&A with tea, and actually ironically today I've got a weak instant coffee in true New Zealander fashion. So after our last pig episode went up on the kuni jaw abnormalities, I had a lot of people making requests, so I actually put it out there and said, does anyone have any particular questions that they want me to go over? And got a massive response. So today we're going to start with part one, because I got so many different requests for so many different topics. A lot of them cross over, but it's definitely, unless you guys are looking for a 4-hour long episode, it's definitely going to be a few parts to it. So part one today, I thought we'd hit up the main ones that lots of people are asking about. So vaccines is definitely the number one, vaccines and worming. And then we'll cover some other little things as well. So Kelly Troop, for example, she said vaccines, drenches and how to trim feet. So Kelly, yeah, we'll go over drenches first. There's a lot of people asking about drenches. Vaccines. So Kelly, most of what it comes down to is really what's the use of your pigs? Are they just, if you've got like 1 or 2 backyard pigs, or are you actually in the business of breeding them? Are you rearing piglets? Do we need to worry about reproductive diseases? So if they are just backyard pigs, you're doing pretty well. You can almost get away with not vaccinating or vaccinating very little. No matter what they're for, I would always recommend doing a vaccine for erysipelas and leptospirosis. Erysipelas and leptospirosis, they'll often come in a combination, so you can get different brands where they come in a combo, so it's just one injection for both of them. And the reason why I recommend that is because both of those diseases can affect and kill humans. So leptospirosis causes liver and kidney failure in pigs. They can carry the strain that causes issues in humans, but without showing any signs themselves, so it can be a little bit stealth. If they do show signs from the pig strain, then we usually see it as reproductive loss, so stillbirth and that sort of jazz. But same with erysipelas. So Erysipelathrix brucopathiae is a bacteria that again can affect humans, and it will cause death in your piglets. With a raging fever. It will cause what we call diamond skin disease, which is a really distinctive diamond, go figure, pattern on the skin. And then as they get older as well, they end up with heart issues, congestive heart failure, and arthritis. So I do actually see it really commonly, even in backyard pigs, if they're unvaccinated, it's a common thing that I see cropping up there, so they can carry it for a long period of time. Anyway, both of those, erysipelas and lepto, both affect humans. They're 6 monthly, unfortunately, so where a lot of our livestock, you're giving yearly injections. For these guys, that particular one is every 6 months. So they get their 2 as piglets, the first one at weaning, the next one 4 to 6 weeks later, that's their booster, and then every 6 months for the rest of their life. Now, the other one that you can consider is a clostridial vaccine to cover things like tetanus. Pigs they're less prone than other livestock. So they are not commonly affected by those diseases, so it's not a high risk. Most people don't do it. Again, with the ones that I deal with, most of the ones that I see are pets, so we go ahead and do it at the same time as the leptoerysipelas. Now the next, probably the easiest one to talk about, is if you are rearing piglets or if you're breeding them yourselves. There's a really easy couple that you can give. They're just one-offs to piglets. So it's for circovirus. Is one of them, and circovirus is a cause of a wasting away syndrome around weaning. So that's one that you can do. You give it just one injection at 2 to 3 weeks old for your piglets, and they're covered for life. And then you've also got your mycoplasma hypopneumoniae, and that's a cause of pneumonia, hence the name. And that one as well is just a one-off for life. So again, you just give one to your piglets at 2 to 3 weeks old. And then I suppose if you're actually in the business of breeding, especially if you've experienced reproductive failure in the past, so issues like stillbirth or just not being able to get them back pregnant again, so just poor fertility all round, there's a couple that are really important there. So as we've already talked about, leptospirosis, that's important, but they're going to be getting that every 6 months anyway, regardless. So that's a cause of reproductive failure. The other one that you want to be looking at is parvovirus. So parvovirus is a cause of weak, dying piglets, newborns, stillbirth, and just poor fertility. So not getting back, not being able to get pregnant easily in the first place. So if you're in the business of breeding, then parvovirus is one that you want to give them. So you'd give it to your first time sows. They need 2, so their first one and then a booster 4 to 6 weeks later. And the key is that you need to make sure that booster is given sort of 4 weeks out-ish from going into being mated. So we want to protect her during that period. And then yes, of course, she'll get her boosters for that. So that'll be a 6-monthly booster. And then the only other one, so just to reiterate there, if you're breeding your sows, they really do need, I would be recommending that they have their leptospirosis and that they have their parvovirus, and they need to be having that each time, before they get mated there. So those are your reproductive ones. And then the only other one that I'd recommend is for your piglets, but you're actually vaccinating mum so that it comes through the milk. So it's E. coli, which everyone knows pretty well. There's a very specific strain that causes death, so terrible diarrhea in your little piglets. And so we are doing mum for that. So we're not injecting the piglets, we're injecting mum. So she gets her 2, again, 4 weeks apart, and then she will get a yearly booster, and it needs to be a couple of weeks out from farrowing this time, a couple of weeks out from giving birth. And the reason that we say 2 weeks out from giving birth for this one is because, as I say, we're wanting it to pass through the milk, through the colostrum into the babies, so that they just inherit immunity from mum, and she will start producing her colostrum about 14 days out. So we give it 2 weeks out from farrowing, so that those immune cells are really hitting their peak right as she's in peak production of colostrum. Babies drink the colostrum straight out of the womb, and voila, they've got a perfectly inherited immune system against E. coli. Right, I know that's quite a lot. Most people are going to, if they're just pets, you're going to get away with your lepto, erysipelas, and then plus or minus a clostridial vaccine if that's all you're looking for. But if you're in the business of breeding, those are your other options for you. Right, so we also had quite a few people, so same person, and then Stacey Frederick Atkins as well, shout out there, also asking about drenching, heaps of people asking about drenching. So I guess the first thing we should just mention briefly is what worms are we actually dealing with, because they're different for your different livestock, right? And they're different again for your pigs. So the ones that we're worried about in pigs are going to be your whipworm, that literally looks like a whip. They're pretty filthy, big coiled long things. Whipworm that lives in the intestine. Your stomach worm, which lives in the stomach and causes bleeding in the stomach, and so you can see black tarry stool coming out from losing blood that way. And that's usually an issue in your kind of up to 6-month-olds. And then we've got your liver worm. It migrates through the liver, so it causes liver function issues. And that's going to be seen in your growers usually if you've got issues there. It causes pneumonia as well. It also migrates through the lungs, so causes pneumonia in your growers as well. And then mange, I know that's not an internal worm, but our drenches will also do your external parasites. So pigs are really prone to mange. They'll pick it up straight from mum, like scabies, like what you see on your third world animals. So they're mites that live on the outside of the skin. Now, the 2 drenches that people are generally still reaching for, as far as I know, all around the world, including here in New Zealand, are going to be your ivermectin and your doramectin. You'll notice that I'm using drug names throughout this episode, just because I know that I've got a lot of viewers in different countries here. So you'll have to mention that to your vet specifically. But the ones that we have here in New Zealand are called Ivermec or Dectomax. So both of those, that you can think of them like sister drugs, they're very similar drugs. One just lasts slightly longer than the other. They're injectable. However, you can take the ivermectin injectable dose, and you can give it orally. Okay, so you can give that orally. It does taste a little bit bitter, so I've been told by pig owners that the pigs don't necessarily love it. So I normally recommend people to hide it in your peanut butter and jam sandwich. That'll usually be my hiding tool for anything, any kind of gross tasting drugs I'm trying to get into them. And you can just give that orally to them so that you can give it to them to eat. Now, either of those drugs are generally going to do the same thing. They're generally still effective against any of those worms. There is an exception. Whipworm is developing pretty good resistance against our drenches right around the world, including here in New Zealand. So and by resistance, in case anyone's new to that term, that just means that the parasites have evolved and are continuing to evolve to outsmart the drenches that we have available to us. So that it's a bit of a race against the clock at the moment. We're trying to bring out, develop new drenches to kill these guys, and they are evolving to outsmart them, and so the drenches aren't working as well. So that's inevitable. That's going to happen over time. At the moment, the drenches, those 2, ivermectin, doramectin, are still working pretty well against most of them, except for whipworm. So if you suspect that you might be looking at whipworm, or if your vet suspects that, then you would be wanting to reach for a different drug called flubendazole. So there's a brand called Flubanol out there, but the drug name is flubendazole, and you'll need that one to make sure that you are wiping out your whipworm. Now, if you have big issues with whipworm, the ones you're going to be looking out for there is diarrhea. Sometimes if it's really bad, you can actually get bloody diarrhea, or not quite diarrhea yet, but bloody stool. So it causes, in heavy loads, it causes a lot of inflammation in the intestine there. So that's what we're looking for. Now, in terms of when to give it, we don't need to be doing it a ton throughout their life. We're trying to protect them at the high risk periods, and we're trying to protect the piglets from inheriting worms from mum. So what I normally recommend is drenching mum, so the sow, before she farrows, so before she gives birth to her piglets. There is a particular type of worm where she will actually pass the eggs through her milk, so they can literally be fresh from the womb, a couple of weeks old, and they're already showing signs of worms. So that's a thing. So I would normally recommend giving a drench to mum, to the sow, before she gives birth to her piglets. And then I normally recommend 1 at 3 months old, unless otherwise indicated. Of course, if you've got a little piglet that's looking unwell, you're going to consider worms. But otherwise, 1 at 3 months old, that's going to knock them on the head during the high risk period, during that growing, weaning period. And then after that, I tend to just say as indicated. So I say to owners to make sure that you look out for things like, as we've discussed, your bloody stools, diarrhea, weight loss, pneumonia, or possible liver issues. That's going to be more of a veterinary observation. And so if you see any of those, then they're going to get another shot and some follow-up care there. But if you've already given one shot and it's not coming right, please get your vet. There's obviously a million things that can cause diarrhea and a million things that can cause liver issues. If the pig's really unwell, get your vet out straight off the bat. The other thing I wanted to mention about worms is it depends what your system's like. If you've got outdoor worms, there's not a whole lot you can do about it. But if you've got them indoors and you have a little farrowing area with slats on the ground or any kind of barriers around, some of those worms, the eggs are super sticky and will stick to the environment. So even scrubbing them is, that's only going to do so much. You really need to scrub with hot water and disinfectant. So it's definitely your farrowing areas in between litters, and then just when you're cleaning out your pig house as well. Okay, so hygiene's really key. That's for the liverworm and for the red stomach worm. Both of them, the eggs are really sticky and really resistant in the environment, as in they last for a long time. The other thing I should mention there, I suppose, as a good vet, is that to prevent the issue of drench resistance developing, the way we slow that down is by not drenching unnecessarily. So not underdosing if you're going to drench them, but not drenching unnecessarily, in a way that you can make sure, instead of just drenching straight off the bat, routinely or every time you think they need it, the way you can make sure is actually just take a poo sample. So you can usually pick up a little little sterile pottle from your vet. Otherwise, just put it in a snap-lock bag, keep it in the fridge, take it fresh from the rectum or as soon as they've gone. Put it in the fridge until you can get it to the vet so that the eggs don't hatch in the heat. And the vet is going to run a quick, cheap test on it to tell you how many eggs there actually are there and do you need to be drenching. So I highly recommend that. Everyone should be doing that now. Right. Those are the two intense topics where there's a lot of talking. Next one. Right. We've had a lot of people ask how to hoof trim. Kevin Hamilton, how to manicure a 200 kg plus pig's hooves that doesn't want a manicure. Sure. And how a lot of people have said, how often do you do it? How do you restrain them? What's the confirmation we should actually be looking for here? So it depends. There's obviously individual variation there, how quick the feet grow and what the conformation of the legs are. So if you've got a pig that's got poor conformation, particularly straight-legged, or is a bit lame on one side for a long period of time, has arthritis or something like that, and is favouring one foot, often we'll see one foot, the nail is the hooves are growing a heck of a lot longer, quicker. So you do need to just watch your own individual animals there. Some people will go with a rule of once yearly, or some of them need to be done even a couple of times a year. If you've got them outside and they can move around on concrete from time to time, they'll wear them down themselves to a certain extent. So I just mean to say that it is very variable. I'm going to, in terms of conformation and where you're actually trimming those lines, I'm going to put a picture down the bottom of the screen here I think I might have to hand draw it because I don't know if I can get my hands on one that's actually free and available and no copyright on it. But so excuse my drawing if that's what's happened. But it's pretty straightforward. They walk on the nice little soft pads of their feet. On their heel is a nice little soft pad, so it's pretty straightforward. You can usually see the wick in there as well. You can see where the soft tissue comes down to, just like a cat or a dog or us. So obviously you don't want to hit the soft tissue, but you want to get those angles right. So I'll put the picture down there. I think what most people are probably talking about is how do you actually restrain them, right? And like what kind of tools do you use? So I've got a couple of things to show you here. So in terms of restraint, if it's a little guy, so for me, my cutoff would be maybe 80 or flip 100, no, not 100, 80 kg probably would be my cutoff. You can grab the front leg, so put some food down, lure them into a false sense of security. Grab the front leg, you're going to have a really good hold on the front leg. Grab the other front leg and spin them up so they're sitting on their butt and their head's pointing up at the air. So you're holding onto their two front legs here. And that's a really easy way to restrain a pig, just by sitting it on its butt. But you do need a little bit of manpower to do that. So it's with your bigger ones that are really tricky, hey? So as a vet myself, to be honest with you, I cheat a lot of the time because we're out there knocking them out for some other reason, castrations, or, a lot of people will have them sedated or under full-on general anaesthetic and have their feet trimmed and their tusks trimmed and their, drenching vaccinations all at the same time. So that's super easy if they're already asleep for another reason. It doesn't generally warrant knocking them out altogether just to trim the feet, unless it's really bad and they're difficult to restrain. But basically your options are flip them on their bum if they're little enough, snare them if they're a little bit bigger. So I've got some snares here to show you. You can get a few different kinds of snares. So you can get wire snares. Now I don't even carry a wire snare. So this is a snare. A snare is a round loop that goes behind the canines on the top of the mouth. So you slide it in through the mouth while they're eating. Slide it in the mouth there. You want to get it behind the canines, the big, fangs on the side, so that it's secure in there, and then it goes tight. So the harder back they pull, the tighter it goes. So they will get to a point where they pull and then they just freeze, and they tend to freeze really well. They'll scream bloody mercy. So, excuse them for that. But generally it doesn't hurt them a whole lot. The wire ones, the wire snares are harsher on them, of course. They've got very sensitive snouts. I don't play around with a wire snare at all. I don't even carry one. But you can get the nice soft plastic ones like this. Otherwise, actually, I don't use this very often either. What I generally use is a soft rope, and I make my own snare. So I just use a really nice, very soft rope. It doesn't need to hurt them. It just needs to restrain them. So you slide it through, it's got a loop at the end. Slide it through so it's like this. You know what I mean? So it's a noose. So again, still goes through the mouth, still sits behind the canines there. It's a little bit trickier. It's definitely still doable, and I use it all the time in coonies. But it slides off the nose a little bit easier, so make sure you definitely do have it behind the canines there on the top, just because the coonies have got the little stubby snouts. And then as they pull back, it goes tighter on its own, you know what I mean? So they will freeze there, and then you can just stand their little foot on a little block or pick it up, even like you'd imagine picking up the foot of a horse. So that's the way that you'd go there. Other options for restraint are to sedate. So if you check with your vet, it depends on your vet, but some vets will give you out a drug that you can give orally. It's called acepromazine. It's not an awesome sedative, but it just takes the edge off for them. So if you're doing a bunch of them, it just means they're going to be easier to flip on their butt. It's not going to make them go to sleep altogether, but it makes them scream less, and it makes them chill out and stop fighting you so much. So that's another option. And then I guess I should say I have actually got a couple of clients with little pet pigs that actually they're large pet pigs now, but they've had them since they were little piglets, and they were house trained initially, and they taught them right from a young age to lie on their side for a belly rub and to have their feet handled. And not just handled, but to actually, have the feeling of a rasp on their feet and having their toenails clipped. And so they've grown up, and they'll literally just lie down and let them do it. So if you've got a piglet, that's like the number one trick to do is to try and teach them to do that. I'll show you the tools. So what you're going to use is you can use your big hoof clippers. So this is a cattle or an equine product, cattle and horse hooves. just massive chompers off the front there. Or if they've got softer nails, you can even just use your little shears that you use for sheep and goats. So I'll usually use a combination, then I've got a little file there as well, just in case I need it. So those are what I do, and that's probably all there is to say about that. Right, what was our next ones? Maggie Friday, sweet name, that's a very cool name. When, how, and do you definitely have to remove tusks? I highly recommend in your respective countries and states to check out the laws around transport to the abattoir. So in New Zealand, it's gold standard to remove the tusks of boars before transporting them to the abattoir, just safety for each other and for other animals on the truck. But other than that, other than actual legislation sending them to slaughter, it totally depends on you. If you've got entire male boars, as in they've still got their testicles, they've still got testosterone and who knows how much adrenaline pumping around, and they are showing aggression, that's why we're doing it. We want to protect the boars from each other. We want to protect humans and kids, dogs. Entire intact boars can be aggressive for sure, and they can do damage with those tusks. So how often to do it? Usually yearly is enough. It depends how much you want to keep them down. I guess what I would say about tusks is you do not want to be taking them down if you're doing it yourself. Don't want to be taking them down to the gum line. So they do have feeling in those tusks. So on the inside of the tooth, they've got what's called, just like us, just like any animal, they've got what's called a pulp cavity. And the pulp cavity carries nerve endings in there. And when you expose the pulp cavity, you're causing them a lot of pain, long-term pain, and then you're also exposing that cavity as well to infection and other issues down the track. So we definitely don't do that. So I think way back in the day, from what I understand, people used to file, take them off and then file them even down to the gum line. That is not a thing. There are some boars, this is what the science tells us, where postmortems have been done, there are some boars where the pulp cavity does not extend beyond the gum line, but it's the minority of animals. So a safe assumption is that it does extend above. So if you're taking off those tusks, and to do that, you're going to be wanting to use embryotomy wire, which is a sharp surgical wire with handles on it. It's very, very easy to do. You just need them to stay still for it, really. You want to make sure that you're not cutting it off any lower than a couple of centimeters, an inch. I'll usually leave even a couple of inches, because taking it back to that level, that's enough for those tusks to stay inside the mouth, and then you can smooth them off with a little file if that's what you want to do. But in terms of, do you absolutely have to? No, you don't have to. It's just safety. It's safety for the animals and safety for everyone around them if you've got intact boars. You obviously do get castrated males as well that have got their little tusks, and plenty of people there don't take them off because there's no need. Oh, I should say, as a vet, I've been up to a handful of calls where animals, even little castrated males who, they've never had their tusks shortened, have gotten themselves stuck underneath things like fences. It's usually wire of some description. So they'll put their head under a fence for some reason and then lift their head and get the wire hooked in there, and it's just super distressing for them. They never hurt themselves, but it's they're usually caught there for who knows how many hours before someone finds them. It's really distressing. So so that's the only other time that I see issues with them. Right. What else have we got? Castration. Did our own for the first time, but was daunting. How do you castrate? When do I need to castrate by? So there's a little bit, I'm going to have to tread lightly there in terms of talking about how to castrate. So in New Zealand, it's a veterinary procedure. It's not legal to castrate an animal yourself. There's a number of reasons that we don't allow owners legally to castrate their own pigs, and those reasons, vary from they absolutely legally have to have appropriate pain relief, all the way to their ruptured boar, we call it, which is where the organs inside the abdomen, so usually the intestine, herniate down through that inguinal canal. So I'll tell you what I mean by that briefly, because it is important for you to understand, especially if you've got kunis. They've got larger inguinal canals and a higher risk. So when an animal is developing into either a male or a female, everything starts inside the abdomen, right? So they've got their ovotestes, And then if they've got girl chromosomes, they're going to develop into ovaries. If they're turning into a little boy, then they're going to turn into testicles. And those testicles are still up in the abdomen at that point. They descend down towards the bum end inside the abdomen, and then they pop out the inguinal canals. And the inguinal canals are two little holes, one on either side, and they're right in that groin region. So they pop out, are still under the skin, of course. They pop out and they travel down into the scrotum. So we can get what's called a ruptured bore, and this means that the inguinal canals have allowed other abdominal contents, as I say, usually intestine, to pop out and move down. That's another one of the big risks. So I think I'm aware, because I've had a few of these questions, I'm aware there's obviously different laws in different countries here. I'm not going to go any deeper into that. But in terms of, a lot of people have asked, when do we castrate? Do they need to be castrated? Some questions about boar taint there. So in legislation, officially 9 months old is considered a boar. So at 9 months old, we say, yep, chances are they've gone through puberty now, that's a boar. So you want to get it done before that point. That's when they'll ride each other and ride the females and start showing the male tendencies, urine spraying and aggression towards others and to humans and territorial, all the rest of it. So we definitely want to do it before there. Coonies, I should say, again, like to do their own thing, and coonies are not always descended early. So sometimes I have waited until maybe 6 months of age before both testicles have descended, and I know that sometimes it can even take up to a year in rare occasions, whereas a lot of your meat breeds have generally descended really quickly, and people will get in there and do them in bulk, even at 7 days old. Coonies, you just make sure that both those testicles are popping out the back end before you call the vet out, otherwise it's an expensive endeavour. So I guess from a veterinary perspective, well, from a welfare perspective, you want to get them done as early as possible if you're not going to be sedating them in any kind of way. So the younger they are, even 7 to 14 days old, if you're just doing it with local anaesthetic, that's when you want to do it. If you're doing them older than that, so as a vet, I would be sedating them. So for me, I'm trying to offset the risk of sedation with the size of the testicles, with how well developed they are, So I'm normally saying to people around 3 months. And that way I'm not going to lose them under sedation. They're a little bit older, they're able to handle themselves easier. I use a very safe anaesthetic mix anyway, and but the testicles are still very little there. So that's what I do there. In terms of boar taint is a very specific foul smelling kind of odour that is produced when you cook the meat of a boar. It's not in all of them, which is why there's a lot of argument around is it okay to eat a boar or not? Is it going to be nice meat? But in over 50%, I can tell you, they will produce boar taint, and it's due to androstenone, which is a male pheromone predominantly. So they excrete this smell, they excrete this pheromone in the boar's saliva and other bodily fluids. So they're trying to attract the females with it. They're trying to smell like a man, but it comes out in the cooking and will put people off pork for life. So it's not okay to go into the food chain that way. If you want to give it a go and eat your own boar, then power to you. Hopefully you'll be one of the less than 50% that doesn't have boar taint, but there you go. There were a couple of other questions there about it. In your experience, this is a good one. In your experience, will castrating an adult boar make him less aggressive? I get asked that a lot. That's a really good question. So short answer, yes. Long answer, not necessarily. So most of what we're seeing with boar aggression is because of the male hormones, right? It's because of testosterone and all the effects that that's having on the body. If we remove the testicles, which is where testosterone is produced, we're removing that stimulus, we're removing that hormone. So go figure, absolutely, it's going to decrease those boar behaviours, things like spraying, urine spraying and aggression, if not eliminate them altogether. Now there hasn't been a lot of studies on this, but there has been some, and the evidence tells us that the older that they are, and these are small studies, the ones that I've read, But it looks like, and I would agree with my experience, that the older they are, the higher the chance that they've already developed a conditioned response against something. So yes, you're removing the testosterone, yes, you're going to be reducing those behaviours, but the longer their life has been where they've been exhibiting those behaviours, the higher the chance that some of it's going to linger. And this is because they've developed a conditioned response now. They've got a learned response, and it's kind of ingrained habitually in their brain. And by conditioned response, what I mean there is they've had some kind of payoff in the past for those behaviours. They've exhibited those, aggression, for example, is usually what people are worried about. They've exhibited aggression and they've had some kind of payoff for it. So a common one that I will hear is, a year and a half old or a couple of years old when I castrate him, massive big testicles, and they will say, yes, the aggression went down significantly, but he's still got a tumultuous relationship with the dog, because he's always fought with the dog, and when he fights with the dog, he ends up getting the dog's dinner. You know what I mean? So it's become a learned response over time. Definitely still worth doing. I don't think I've come across an animal yet where it hasn't made any difference. That would be unusual at least in my experience. It usually drastically decreases the boar behaviours, if not eliminates them altogether. And if they're young, if you've got it under a year old and they've only just started these behaviours, absolutely you're going to get rid of the behaviour. Yeah, in my experience. There's probably going to be a lot of people that want to argue with that one. Right, okay, oh my goodness, we must have been going for a while. Oh, I just wanted to show one other thing. Someone asked, I can't find it now, the question. Somebody asked something about how do you inject easily. I think they were talking about drenching specifically. How do you inject? I want to show you guys a little trick. So obviously we've talked about drenching specifically. You can give ivermectin orally. So that's hopefully going to save some of you guys. But as a vet, and you guys can probably get your hands on them as well, the two tools that I have at my disposal are a pulse syringe. So this guy here, I don't know how much you guys can see it. It will be, how long would this one be? Probably a metre and a half, maybe, metre and a half long, around about that. We've got a pulse syringe here, so there's a syringe on the end. The downside to this guy is when you're trying to get in a large volume, they're going to move away from you the second they feel this, right? So you need to have a large gauge needle, which means a really fat needle on the end there, so that you can, boom, slam them with it really hard. All the drug goes in quickly, and by the time they've gotten away, they've already had all the drug. I don't like using it. It is bad for my relationship with the animal and for the owner's relationship with the animal. It's painful. You have to use a big needle. So I still carry this, but I hardly ever use it. I would only use it if the animal is so dangerous that I can't get anywhere near it and I have to stand back on the other side of a big fence. But generally what I use now, I'll show you, is this guy. So this is a little IV line extension, so an intravenous fluid line. And your vet will probably give you one of these or sell you one. It's got what's called a port on the end. So the port, I don't know if you guys can see that from there. The port is where a needle will stick into, right? That's where the needle goes, the needle with your syringe at least. So I'm holding this end, and then we've got this one. This is just my little baby one. It's only about a meter long itself, but you can get longer ones. And then on the other end is a needle. So you can use a tiny little needle. You can use a kitten-sized needle if you want, and I often do, where they barely even notice. They go, oh, and then they just truck on and carry on eating their bucket of mash or whatever, and they don't even notice you injecting. So all you do is you little scratch if they'll let you scratch, because that helps to desensitize the skin so they don't notice as much. If they don't let you scratch, I just lean over and pop it in the bum. That sits there, and if they move away from you, you've got this whole 1.5 meter space. And then I just sit there and I just inject slowly, just really nice and slow, and they barely even notice. It means they don't hate me as the vet, they don't freak out every time my truck pulls up, and if you're doing it yourself, it's a nice easy way that you can manage your relationship with them. So that is awesome. Someone showed me that a few years ago, and I've never looked back to that old pulse syringe. The only downside to using this guy is obviously there's a little bit of wasted drug. So you don't want to be injecting air into their muscle, right? That's a horrible idea. So you need to make sure that you've primed the tube. So you would get your drug, you would fill the whole thing up until it's dripping out the needle, and then you get your dose, right? Your full dose ready to go. Does that make sense? I think I've worked it out before, and this one holds all of 0.7 of a mil. It's hardly anything. But yes, I guess if if you're using anaesthetic agents and that kind of jazz, then it's gonna make a difference there. So just something to consider. A little bit of wastage. Make sure you're not injecting air into them. Fill it up with the fluid, with the liquid that you're injecting first. Even if all you do is fill it up with sterile water first, and then the injectable agent behind that, whatever it is that you're doing. Okay guys, all right, I'm definitely going to leave it there. I'm pretty sure we've already come to, I don't know, can't be far off kind of 45 minutes, so I'll leave it there. Hopefully that was helpful. Go ahead and keep sending them through. I'm sure I've got another part 2 or part 3 to come, so I will keep going. Thanks for checking in. Please don't forget to subscribe so you get the next ones, and just to support me so I know that you guys are enjoying them. Thumbs up if you found them helpful, share it, and yeah, I'll see you for the next one. Okay, bye bye.